Hi there, this is Ben with HCO Thrive, and today we're going to talk about skilled nursing facility quality data. Basically, we'll give an overview of what we offer and some of the methodology behind how we came up with it. All of the data we have is from the CMS Quality Compare website. It's been aggregated since program inception, transformed into longitudinal stacked data sets. Modifications are standard, standardizing names, consistent format, removing duplicates, etc. And on the right, you can see what datasets we currently offer. These datasets are used for two purposes: Quality Reporting Program, as well as the Star Ratings on Nursing Home Compare. Here's a little more information on the dataset sources. In terms of Star Ratings, it comes from CMS's Health Inspection Database. This is where the results of health and/or fire inspections are stored. Payroll Based Journal, this is staffing ratios. Minimum Data Set, that is assessments that are given at the start and finish of resident intake and outtake, as well as Medicare claims data for events such as rehospitalizations, discharge to community, and other ones like that. In terms of the quality reporting sources, that mainly comes from the minimum data set and the claims data. These are divided into short stay measures, less than 100 days, and long stay measures, which are greater than 100 days. First in alphabetical order is the claims data set, which I was just talking about. Again, from Medicare Part-A, measures include rehospitalizations, discharge to community, ER visits. In terms of values, you're going to have adjusted scores, expected scores, and observed scores. Let's take a look at the data so you can see what I'm talking about. So here's our claims data table. And as you can see, the measure names are not all that informative, so you're going to want to look at the documentation to understand what you're dealing with. And here you can see we have definitions: percentage of short stay residents who were rehospitalized after a nursing home admission, adjusted score. You can look at CMS's documentation to understand more about adjusted, expected, and observed. And at some point, we'll also do an overview of the methodology. Next, we come to fire citations. All Medicare certified skilled nursing facilities must comply with life safety code requirements. This is usually managed by state agencies, so it's going to vary state by state, but it usually coincides with the health survey. And in terms of the data, it varies by date, citation type, and scope. And below you can see an example of what the inspectors are looking for. This little example just shows patient sleeping room doors, egress doors, so standard fire safety things. The first thing I want to mention when we take a look at the data is that it's structured in a bit of a different format than most of our normal data, where it's CCN or provider number, measure ID, value, start date, end date, etc. This is designed to encompass most of the information that comes with the fire citations. So you can see the date of the survey, tag number, description, category, and scope, which we'll talk more about with the health inspections, and then whether the data was corrected or not. Down here, you can see the scope definitions. It does say health inspection score, but the scope is going to be the same, whereas the tags are going to be different between health and fire citations. Health inspections occur roughly once a year or every, 14 months maximum usually. Another reason an inspection may occur is based on a complaint. Recently, CMS has decided to prioritize complaints over routine inspections, so that's something to be aware of. If inspectors do find noncompliance, the facility is going to receive a citation, and then they're going to have to come up with a plan to remedy it. If they don't do anything, then they will be fined, and CMS can withhold payment. Below, you're going to see severity by scope matrix going down. You can see most severe to less severe, and then from left to right, isolated, pattern, and then widespread. So scope in terms of how common or how frequent the violations are. Here again, you can see that the data set is in a different format, just like the fire citations data set. You can see the tag, description, category, and scope, as well as the survey date and the date that it was correct. CMS's Provider-Based Journal system is where they get staffing information from. This is going to include total staffing, RN staffing specifically, physical therapist hours, and staff turnover, including admin turnover. It's important to note that recently the staffing mandate from CMS was overturned in court, but they still do use the staffing information to calculate star ratings. You can see on the right how they calculate case mix adjusted rates. So RN hours per resident day and then total nursing hours per resident day. Staffing information used to come from Casper and the resident census, and they'd use both of these to calculate ratios. This was part of the MDS assessment given at intake and outtake. The issue with this is that it was highly unreliable. CMS had to exclude many values that didn't make sense, whereas Provider-Based Journal is literally coming from each skilled nursing facility's software database for their human resources systems. Here's the data table for the PBJ. It has provider in the name because it comes from CMS's provider data set at Nursing Home Compare, which includes a lot of information, star ratings, and citations as well, citation summaries. So this was extracted from that data set and then provided as its own unique data set. And you can see certified beds, total residents, and then turnover measures are here. And then there's also case mix adjusted. The quality measures that come from the MDS assessments include things like pressure sores, fall rates, medication, restraint use, and more. Below, you can see an example of the MDS assessment. That's just one question. MDS, required on admission, periodically, and discharge. All residents must have it regardless if they're funded by Medicare or Medicaid. And again, information on health, physical functioning, mental status, their well-being. And basically it's used to assess needs and plan of care and to determine whether or not treatment was effective. Here's the data table for the quality measures. As you can see, similar to the claims, these measure IDs are not very informative. We do try and keep original names, variable names from CMS whenever possible, so that's why these remain like this. But in the documentation, you can see definitions for everything. I've mentioned the Skilled Nursing Facility Quality Reporting Program a few times before. This is required by the Impact Act of 2014, which stipulates up to 2% withholding of the annual update payment if they fail to report. Once again, measures come from the MDS. Some vaccine measures come from the National Healthcare Safety Network. And lastly, some variables come from Medicare claims, as discussed prior. Here, for values, you have observed values, risk-adjusted, comparison nationally, so are they above or below the national average level, and then sample size as well. Looking at the QRP data table, you can see it's quarterly as well, measure IDs, and then definitions of the measure ID, denominator, numerator, facility rate, and so forth, adjusted, observed. And here on the next page, you can also see comparative performance. So this is what I was talking about in terms of comparing a facility's rate to the national. And finally, we come to skilled nursing facility star ratings. Something I haven't mentioned before is that unlike other providers, skilled nursing facility data is released on a monthly basis. So what we did is pull out the star ratings from the Nursing Home Compare provider file, and then we calculate quarterly averages as well as each individual month as reported. So the advantage of that is each skilled nursing facility has one row for each month and star ratings for each month, or star ratings average for the quarter. For the quarterly ones, you know, the first month of the quarter and the monthly star ratings are going to be the same. And then if there's any change, it'll change as you get further into the quarters. Star ratings are from 1 to 5 stars. Again, short, long stay quality measures, staffing, health, fire inspections, and then an overall rating. In terms of how the star ratings are assigned, it is quite complex. An example, comes directly from CMS, sort of their general overview of how the star ratings are assigned. And then each type of star rating has a lot more complicated methodology to it. You want to look at the star rating user guide that's produced by CMS to get a more full understanding of that. In case what I was talking about isn't entirely clear, you can take a look at the monthly, LS, long stay quality rating 4, overall rating 5, and you can see it's 1 month period. Descriptions below. And then looking at the quarterly, again, pretty simple. Dates are for the quarter, and this is the average. And that's it for skilled nursing facility quality data. Do let us know if you have any questions, and thank you for watching.